Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Prazosin. Its brand name is Minipress. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how Prazosin works. We'll then discuss indications or reasons we would prescribe Prazosin to a patient, then contraindications or reasons we would not be able to prescribe this medication. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does Prazosin work? Well, first of all, Prazosin is a quinazoline derivative. It causes reduction in total peripheral resistance and relaxes vascular smooth muscle. This action may be related to a postsynaptic alpha-adrenoreceptor blockade. In terms of indications or reasons we would prescribe this medication to a patient, we see it used in hypertension, as well as benign prostatic hyperplasia, or BPH, and also some off-label uses in congestive heart failure, poisoning due to scorpion venom, as well as PTSD, or post-traumatic stress disorder. With respect to contraindications, the only one here is that a patient would not be able to use this medication if they had a hypersensitivity to Prazosin, other quinazolines, or any other component of the formulation. Now what about dosing with Prazosin? So in hypertension or high blood pressure, we would see an initial dose of 1 milligram orally 2 or 3 times daily. They may titrate this dose slowly up to 20 milligrams per day, given in divided doses. The usual maintenance dose would be between 6 and 15 milligrams per day, again in divided doses, and it should be noted here that some patients have used 40 milligrams per day. In benign prostatic hyperplasia, or BPH, the initial dose would be 0.5 to 1 milligrams orally at bedtime, with a maintenance dose of 0.5 to 2 milligrams orally twice daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Prazosin, so we'll go over some of those here now. 5% of patients may experience palpitations, while 1 to 4% may experience orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position. 5% may experience nausea, and 6.5% may experience asthenia or abnormal weakness. Dizziness may occur in 10% of patients, and headache in 8%. Lethargy may occur about 7% of the time, and 7.5% of patients may experience somnolence. Now, some more rare but serious side effects would be pancreatitis and priapism, which both would happen less than 1% of the time. That's all we're going to talk about today with Prazosin or Minipress. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.